last year's New Year's resolution to help the national vaccine programme.
So, that is you all done.
Hooray! Thank you.
Up to me, yeah, let's do it.
Nearly 1,000 hours later, and nobody in the east of England has volunteered more hours than Alex Spence.
It's all about them getting to do things when they're freed up from this. So we had a lady the other day where she said I'd literally saved her wedding because she needed a vaccination within the next 2 days or she wasn't going to be able to get to Barbados for the wedding.
It's not just wedding days being saved. Volunteer contribution is also helping keep pressure off an NHS under strain. Despite record-breaking vaccination figures this past fortnight, Omicron remains on the rise and the NHS is taking no chances. This is a new temporary Nightingale hub being built, one of an initial 8 sites across England. In London, the hub will be here at St George's Hospital. NHS trusts have been asked to help identify more sites like gyms and education centres that can be converted to help create up to 4,000 so-called super surge beds. The expansion comes as the number of people in hospitals with COVID rose above 10,000 for the first time since March.
What we're doing here is we're preparing for the worst whilst hoping for the best. It's a no regrets approach. What you don't want to do is hit a point where you need to treat very large numbers of patients, but you simply don't have the facilities and capacity to do it.
Questions remain over who will staff the new hubs. The Royal College of Nursing has sounded the alarm over worker shortages and low morale. A survey of more than 9,000 UK nursing staff has found that 57% said they're considering or planning on leaving their job. Around 3/4 said that in the last year they'd worked when feeling unwell. And 18% said they weren't able to take annual leave.
We've got a nursing profession that's under intolerable pressures. It's a workforce in crisis. And if we don't address the crisis in the nursing profession, then we won't have a health and care service that's fit to deliver for those that are in desperate need of it and deserve actually the care that the health service should be able to deliver.
The Nightingale surge hubs become the latest response to the rapid spread of Omicron and the prospect of another major wave of people relying on the NHS for treatment. Sadia Chowdhury, Sky News.